Well, for months, public health experts have urged people to stay home and avoid gatherings in order to limit the spread of COVID-19. But now some of those experts are also publicly supporting those who want to protest racism and police brutality in the streets. Abraar Karan is a physician at Harvard Medical School who's been working on the COVID response in Massachusetts and has come out in support of the current protests happening right across from the U.S. He joins us right now in Boston. So, Dr. Karan, thank you for joining us today.
Thanks so much, Michael.
You know, as we look at these protests around the world, the United States and Canada included, you are supportive, but there are public health officials who are asking people to still stay at home to prevent the spread of COVID-19. But you don't seem to be worried about the potential risk here.
No, Michael, I think, we are absolutely concerned about the risk. We've been very straightforward that there is a high risk with protesting. Transmission dynamics have not changed. Large crowds are still risky. Not wearing masks, still risky. People need to recognize that while we as public health experts are very clear that transmission risk is the same as it was in the past, that right now what we are trying to do is to mitigate the risk to people who choose to protest, who protest knowing the risk that protesting brings. We've been mitigating risk throughout. When states reopened too early, when they reopened prematurely, we were mitigating risk at that time too. We were offering the same advice and the same counsel, and that hasn't changed.
Mm-hmm. And so how are you mitigating it in this case then?
So in this case, we are encouraging people to wear masks. We are encouraging people to keep things outdoors, to physically distance as much as possible, to avoid crowds when possible, to still physically distance, to not go if you're having COVID-like symptoms or if you've had high exposure situations to people with known COVID. We are saying all of those same things. We're saying, and we are also recognizing that actually the response from law enforcement can also increase that risk. Tear gas causes vigorous coughing. It causes vigorous inhaling. It causes people to panic, to take off their masks, to crowd even more. So we need to be clear that actually, even within protests, there are differential risks. You may have a peaceful protest where people are wearing masks and are keeping distance and are outdoors. And then you have some where people are being physically, getting into physical altercations because of the use of police violence.
Mm-hmm. You know, it's interesting to hear some protest leaders because they also make the argument that, this may be a risk that some are taking by going out and protesting right now, but they also make the argument that the status quo is also a risk in terms of public health against African Americans. Do you agree with that assessment?
Absolutely. So we knew, just looking at the data here in the United States, we know that African American patients are more likely to require hospitalization, are more likely to have comorbidities that can lead to more severe disease, are less likely to get testing, are more likely to be faced with discrimination if they wear masks. And keep in mind, so these communities, our African American communities, are at the center of the COVID-19 epidemic in the United States. They are disproportionately suffering, and yet places reopen prematurely in spite of that. And so now when they're protesting as public health experts, we are providing them with the guidance to do it as safely as possible.
Mm-hmm. Now, of course, there are those that are criticizing this, those that say it is hypocritical to be defending these anti-racism protests while just weeks back, anti-lockdown protesters were being criticized by many of the same advocates of this current protest.
So in April, we were at the peak of our epidemic. We had very high transmission in the community. Keep in mind, we have already prematurely reopened in the United States, right? And so now as people are protesting, we're providing that advice. But April was not the same as today, and today is not going to be the same as June or July. And so again, we acknowledge the risks. I was very vocal from the start saying that protesting in this situation, protesting in the past, carries the same transmission dynamics risk. That has not changed.
Okay. Dr. Karan, thank you for the time. Appreciate it.
Thanks, Michael. Appreciate it.